classified into two types: monophasic liquid dosage forms and biphasic liquid dosage forms. Okay, so monophasic liquid dosage forms and biphasic liquid dosage forms. Okay, this monophasic is of again two types based upon the use. Okay, so these are the monophasic liquid dosage forms which can be used internally, and say those examples are pharmaceutical syrups, pharmaceutical elixirs. Okay, these all are examples of monophasic liquid dosage forms which we have already discussed. Okay, now another one is external. Okay, so in monophasic, based on the use I told na, so there will be external use dosage monophasic and internal monophasic. Okay, external and internal. Like internal, I already told you, syrups and elixirs are the pharmaceutical examples as you already prepared in the lab. Okay, and coming to the external use means they cannot be administered into the body. Okay, they should be used on the skin, or else after using we spill it off, like mouth washes. So mouth washes, why we use mouthwash? To clean our teeth or something, and after using the mouthwash we just spill it off, right? We just spill it off. And later gargles, if we get any throat infections, doctor will give us a gargle. The best marketed example, Listerine, blue color and green color Listerine will be there now. So that we'll take and we just have gargle over here and we'll just spill it off, right? So these are said to be external used monophasic liquid dosage forms. Monophasic means it contains a single layer. Single layer means single phase. That means completely miscible. For example, our kitchen example is salt solution. When you take the water and the salt, okay, it gets easily miscible and it gives us a clear solution. That is called monophasic. Okay, now coming to the next topic, those are biphasic liquid dosage forms. Biphasic liquid dosage forms are nothing but, as you already know, again I would like to tell you one kitchen example, oil and water. Oil and water. Okay, these two are liquid ones, so they cannot be miscible. So the word miscible is nothing but immiscible. Okay, even they are not miscible, we want some pharma products. That's why we are manufacturing biphasic liquid dosage forms. For example, in a home, Jerusalem syrup would be there, like Jerusalem suspension, the pink color for gastritis we use. That is a suspension. And even girls, very famous and we use very importantly that calamine lotion, lactocalamine. We'll apply on the skin. So that is also a type of suspension, emulsion. Okay, so these are kinds of suspensions and emulsions we use in daily life. But the special is that these are made up of two phases, oil phase and water phase. Oil phase and water phase. Okay, so the biphasic are of the two types we are going to discuss, suspensions and emulsions. Okay, as you know, I have already discussed the advantages of liquid dosage forms and disadvantages of the liquid dosage forms. Now I would like to start about emulsions. Okay, as you know that suspensions can be made up of different excipients, as I told you, like wetting agents we use buffers, we use preservatives, we use vehicles, okay, and we use some kind of solid materials, yes or no? And we use many things to make a formulation. Like that, emulsion also can be prepared with the help of different excipients. Before that, I would like to tell you what do you mean by an emulsion. What do you mean by an emulsion? Okay, the emulsion is nothing but, I already told you, it's a biphasic liquid dosage form. It contains two phases, oil and water. Two phases will be there which are never be miscible. They are in the state of immiscible. And I have already mentioned the basic difference between a suspension and an emulsion. In a suspension, solid plus liquid which are immiscible. But here in emulsion, two liquids will be there. Oil and water. Two liquids will be made emulsion, and a solid and a liquid will make a suspension. The best practical example for the suspension I already told you, sand water.